her son actually came to see me. Well, maybe you introduce. You talk about your son's story.
Yes. It was almost 10 years ago. And my son was diagnosed by a local orthopedic doctor as having OCD of the knee. So the OCD stands for some big long name, but they shorten it. And he was told, he was 13, and he was told that he could never play sports again. So this kid was a sports guy. I mean, he played every sport imaginable.
And he was a quarterback, football quarterback.
At that time, he was in 8th grade, so junior varsity quarterback. He played basketball and soccer. Had a very hard time sitting still. So being told that he could never play sports again was highly devastating. So of course we were after a different solution. We also took him to Boston Medical Center for Children, and weren't told quite the same thing, but pretty close to it, which wasn't satisfactory for us. So we came to see Dr. Yang, and she worked on him for quite some time. I don't remember how long, but I know it started out like almost every day.
9 years ago.
And then it went less and less and less, as he got better and better. And he went on to be the high school quarterback and get a
he was
position.
I think local, our newspaper also reported him.
Yes. He played for Radford. And then he got an offer to play quarterback in college as well. And he went on to do that, and then he left football and went on to play rugby at college. And he is now getting ready to graduate college. And he has had an extra almost 10 years of playing sports that he wouldn't have had. And I've asked him, numerous times over the last 5 or 6 years, is anything going on with your knee? And he always says, no, it's all good.
Yeah, great.
Nothing, no issues.
So if you compare, if he actually that's the best gift as parents to you kids. If when her son at 30 years old he got the surgery, then his life is totally different than what his life now, or even back to the past 9 years.
Yes, because I was involved with a Facebook page for this illness, and everybody was putting their kids through the surgeries. And I watched year after year, these kids always had to go back and get another surgery and another one and another one, and it never ended. And they still have troubles after 3-5 surgeries.
Yeah, if they got the surgery when he was 30 years old, actually at that time when they went to hospital with Debbie, her husband, and the doctor even don't want them come back and immediately wanted the surgery, and Dave insist, say no surgery.
Yes, it was. My husband and I did fight over this because he was adamant that he was not going to have this surgery. But when a doctor tells you this, you're nervous and you're taught to go with what the doctor says. Don't do that. There are other ways. And my husband and I did fight.
Yeah, he
and
very determined.
I'm so glad my husband won because he was right.
Also your decision too.
Yes.
So now they is very active, still very active, play sports. So it's health. And I think after that, you went back to the hospital to check his knee, and the report said he's totally normal.
I didn't remember that, but if I told you that, it probably did happen.
I saw it on your Facebook. You put the result on the Facebook.
Oh, I know. Yes. I do remember that now. Yeah, because it comes up on my memory every once in a while. Yeah, I do remember that.
It's a long time ago.
Yeah, it was the okay for him to play sports, the checked box. Yeah.
Right, yeah. Great, yeah. See, that's important. That's important. I think. Let me see if any people have questions. People me. Yeah. Okay. no questions. People can ask questions. So this is just a very good example. Say that as parents, that's the best gift for your kids. No surgery, because after surgery, you muscle. This is a non-reversible process. So after surgery, the kids' whole life is changed. Maybe a whole life. I have another patient. Her son is also 12 years old and also have the knee pain and went to hospital, had surgery, and then after surgery his knee is even worse, and then he did the second surgery and even worse, and the third surgery went to the better hospital, and after that surgery even the pain pills cannot help.
Right.
Yeah, so that's the life is totally different, totally destroyed. It's very, look at that boy, we feel very sorry.
Yeah, because once you start, you can't really stop because you keep needing more and more and more.
Yeah, once you have you physically damaged, we said the meridian, the qi will also be blocked, and the muscle depends on how the surgeon did. Every surgeon have actually different the surgeon have the qualities also different. I have one patient, his scarf, one is above, one is low. Two surgeries. One looks smooth, another one looks very ugly.
Yeah.
So also depends on which one, who did the surgery for you. Also the results are also different. Then the muscle, once the muscle remapping, and it's non-reversible. So that's difficult.
Yeah. So I would really like to encourage everybody. I know we've all been taught, do what the doctor says, go to the doctor, but just wait. Come see Dr. Yang first.
Thank you.
If it doesn't work out, then go to the doctor. But you have to come here first.
Thank you. No, I think that's the thing. Think about another alternative way. Don't do the surgery, because surgery will be the last thing.
You could still do the surgery if you really want to, but just try something else first.
Yeah. So that's the best gift you can give to your kids, like Cindy
and to yourself too.
Yeah. Yes, that's
right. For any surgery you might need.
And his son, they will get married this September.
Yes.
See, he's playing that's he very healthy. See his knee? Oh, his knee also, I remember. So after I treat him, he also even did a yin yang symbol on his knee.
Oh, he did. That's right. He got a tattoo.
Yeah, he did a yin yang tattoo on his knee. To
symbolize his recovery. Yes.
See how heals, so heals.
Can you see the tattoo in the picture?
A little bit.
Oh yeah, right over there.
Yeah. I did have his picture. He came back, and then we took picture together.
Oh yeah, yeah, that was cute.
Thank you so much for sharing.
Thank you.